I think the plan that you make about your recovery and about your early warning signs and your relapse prevention looks very individual, and what might work for you might be really odd to some other people, but it might be the thing that keeps you really well and on track.
My name's Ghadeer. I'm a psychiatrist, so I'm a doctor that works around the hospital helping people with their mental health.
My name's Lucy. I'm a senior mental health nurse and I work in the acute hospital, which means I work in A&E and the paediatric ward supporting people with their mental health. I think getting a diagnosis of any illness is a very tricky time in anyone's life. I think it's very challenging. I think particularly with a mental health illness like bipolar, it can come with extra worries about what that means for you and your life and how your life might look different. But actually, there are so many treatments that can help you, and learning to manage it is the key thing to your recovery, really, isn't it?
It's important to remember that everyone's bipolar is different, so everyone's experience of their condition is really individual.
If you have bipolar, it might not look the same for you as it might someone else, but I guess that again says how important it is to learn your own self, your symptoms, your signs, your triggers, and working around them and to reduce them. I think often medication sounds scary, and it doesn't have to be scary if you know that your clinician is going to put you on the appropriate medication. It can be adjusted for you, and learning to manage any side effects you might have. It's important you talk to your clinician about those side effects quickly, because often they can be reduced or managed.
The problem with medication is there's lots of misinformation around it online, and someone could tell you something that might not necessarily be true. So it's important to never stop your medication without telling someone or speaking to someone about what fears or concerns you might have surrounding medication.
Yeah. And I think as well, it's sometimes, unfortunately, a little bit of trial and error. And actually, sometimes it might take a bit of time to get the right dose for you, but that doesn't mean you can't get the right dose for you.
Exactly. And I think it's also important to mention that some medications come with frequent monitoring, so that you might go for a blood test to get checked out. You might get like a tracing of your heart, an ECG sometimes as well, just to make sure that everything's working the way it should be.
A lot of the time it's to make sure that you're not having too much medication. Actually, they help in making sure you're not too sleepy or you feel too sedated or you're feeling a bit drowsy. We don't want you to feel those side effects. Actually, having your bloods done occasionally will help us adjust the dose so it's right for you.
Medication, like you mentioned, is a really important part of staying well with bipolar. It's one of the key parts, but not the only part.
It's not the only option, but I think it is the best option alongside other things. I think it is very helpful and critical in keeping you well and helping you get to a place where you can engage in things like therapy and other groups.
Yeah, and you started mentioning other things that could help other than medication, and therapy is definitely a big one of them. So there are multiple types of therapy that we can have. One of them is called CBT, which can sometimes help us understand, the odd experiences that can sometimes be really scary that we're having, make sense of them, and talk with your therapist about what to do next time when something like this happens. Another type of therapy that can often be really, really useful is family therapy. Because in family therapy, we understand, you can tell your parents and other people how you feel so that your family can understand your experiences. And you can also understand how they feel about it. And that's a really nice process, because then these people can be around you and help you when you need help. And it makes the bonds better between you, and it reduces a lot of the stress that you could have at home, which could trigger an episode.
Yeah, I completely agree. And I imagine, a lot of young people from my experience can feel quite lonely and isolated when you receive a diagnosis like bipolar, because not that many people at your age might have it. And actually, it could make you feel like you're different, you're the only one that has it. And actually, there are a lot of other support groups for families with young people with bipolar, and also making sure that you've got supportive friends around you who are going to encourage you to get help if you need it. Sometimes peer support is really helpful. I think when it's done in a safe way, it can help young people come to terms with their diagnosis and also relate to other people that have got the same experiences, or not the same, but similar experiences. And often sharing those experiences in a safe space can be really therapeutic. And we can, also look at involving your school to make sure that they are aware of any adjustments you might need. And I think the important thing to say is that just because you have bipolar doesn't mean your life has to look very different to how you would like it to look. There are lots of other self-care options. Obviously, I think having an outlet, whether that be an interest that you like sport or makeup or whatever it is that you enjoy doing, having somewhere to release that energy, to put a bit of focus, and that makes you feel good is really important.
A lot of people with bipolar are very creative in nature, and we don't ever want you to feel that that has to be taken away from you. And like you mentioned, lots of people with bipolar will go on to have very fulfilling lives and become very successful.
So I think it can be really hard as well to get into a routine sometimes. I think taking medication, eating well, maybe doing a bit of exercise or doing a sport that you enjoy, going to school, all of those things take quite a lot of time and energy. And I think getting those routines in can be really helpful to making sure that you stay on track. And knowing that, if you do fall out of routine, that's okay. You can step back into it. But gaining a routine would help you in managing.
So having a routine is really important, but we also understand that you're young and sometimes you're going to want to go out and have fun. And just because you have a bipolar diagnosis doesn't mean that you can't do those things. But that it's important that when you do them, that you surround yourselves with people that you trust and that will help you and help you avoid anything that might trigger you or trigger a relapse.
I think it's important to acknowledge that young people are going to experiment with alcohol when they're old enough, and going out at night or engaging in different kind of social circles, getting new friends at college, things like that. I think it's really important that at least one or two people that you can have that are trusted people that know your relapse indicators, what it might look like if you are falling into a manic episode or into a depressive episode, and actually understand what might help you get better, so that if you are going out on a night out and they know that something might trigger you, they can kind of support you in a safe way, in a kind of dignified and private way, to take you aside and give you some support, or maybe take you away, support you to go home, or whatever it is that might help you in that moment. You've got almost like an ally that can help you as like a little recovery partner.
Yeah, and I think the importance of making the plan that we mentioned with the people you trust comes in here again, because then you can choose who to share this plan with.
I think the plan that you make about your recovery and about your early warning signs and your relapse prevention looks very individual, and what might work for you might be really odd to some other people.
Yeah.
It might be the thing that keeps you really well and on track.
And it's going to be an experimenting thing where you try something and see if it works and try something else. And it's a journey.
Yeah, it's a marathon, not a sprint.
Exactly. For more information on bipolar disorder, visit the Best For You website.
You could also text NATTER on 85258 or call NHS 111.